Insulin and pancreas health issues, symptoms, and medical advances. The insulin is a hormone produced by the pancreas that plays a key role in regulating blood sugar levels in the body. It allows cells to absorb glucose from the blood and use it for energy or store it as fat. Insulin helps keep blood sugar levels within normal ranges and prevents hyperglycemia and hypoglycemia. People with diabetes have an impaired body's ability to produce or respond to insulin. This can lead to elevated blood sugar levels, which can lead to serious health complications if not managed properly. There are two main types of diabetes. Type 1 diabetes. The body does not produce insulin. This type is usually diagnosed in children and young adults. Type 2 diabetes. The body cannot use insulin properly and may not produce enough insulin. This type is more common and is often related to lifestyle factors and obesity. People with diabetes may need insulin injections or other medications to help control blood sugar levels. The amount of insulin released by the pancreas depends on a variety of factors, including the body's current blood sugar levels, overall metabolic state, and whether the person has fasted or eaten recently. Here are some general details. Basal insulin secretion. The pancreas continuously releases small amounts of insulin throughout the day and night to regulate blood sugar levels during fasting. This basal insulin secretion helps maintain stable blood sugar levels. The typical basal insulin secretion rate in healthy adults is approximately 0.5 to 1 unit per hour. Bolus insulin secretion. In response to a meal, the pancreas releases large amounts of insulin to control the rise in blood sugar levels caused by carbohydrate intake. This is called bolus insulin secretion. Dosage varies widely, but is usually 1 to 2 units of insulin per 10 grams of carbohydrate. The exact amount depends on the individual's insulin sensitivity and the composition of the meal. Overall, the pancreas of a healthy adult typically secretes approximately 25 to 50 units of insulin per day, depending on individual metabolic needs and dietary habits. In patients with diabetes, the body's ability to produce or use insulin is impaired, and insulin therapy may be needed to mimic these basal and bolus insulin secretions to maintain normal blood glucose values. Currently, there are no widely available oral insulin medications. Insulin is a protein that is broken down by digestive enzymes in the stomach and intestines, meaning it cannot be absorbed into the bloodstream effectively if taken orally. However, research to develop oral insulin formulations is ongoing. Scientists are exploring various ways to protect insulin from degradation in the digestive tract and enhance its absorption into the bloodstream. Some of these methods include encapsulation. Encapsulating insulin in a protective coating or nanoparticles to prevent it from breaking down in the digestive system. Chemical modification. Modifying the insulin molecule to make it more resistant to digestion or to enhance its absorption through the intestinal wall. Delivery systems. Specialized delivery systems, such as tablets or capsules, are developed to release insulin in the small intestine, where it is more easily absorbed. While progress has been made in these areas, until now, insulin delivery has been primarily accomplished through subcutaneous injections, insulin pens, or insulin pumps. Some alternative delivery methods, such as inhaled insulin, have also been developed and may be used in specific circumstances. The pancreas is an important organ located in the upper abdomen, behind the stomach. It plays dual roles in the body's digestive and endocrine systems and is essential for maintaining metabolic and digestive health. Structurally, the pancreas consists of a head, body, and tail, with each part contributing to its overall function. In its exocrine action, the pancreas produces digestive enzymes that are secreted into the small intestine to aid in the breakdown of carbohydrates, proteins, and fats. These enzymes include amylase, lipase, and proteases such as trypsin and chymotrypsin. The endocrine function of the pancreas involves the release of hormones such as insulin and glucagon into the bloodstream. Insulin lowers blood sugar levels by promoting the uptake of glucose into cells, while glucagon raises blood sugar levels by stimulating the release of glucose stored in the liver. Common pancreatic diseases include pancreatitis. inflammation of the pancreas, which can be acute or chronic. Pancreatic cancer, a malignant growth in pancreatic tissue that often goes undetected until late. Diabetes, a disease characterized by impaired production or function of insulin. Cystic fibrosis-related pancreatic problems, a genetic disorder that affects the pancreas' ability to produce digestive enzymes. Determining whether there is a problem with the pancreas requires a combination of clinical evaluation and laboratory testing. Here are some common symptoms and ways to diagnose pancreatic problems. Persistent abdominal pain, unexplained weight loss, jaundice, nausea, vomiting, and changes in stools may indicate a problem with the pancreas. Blood tests. These tests measure levels of pancreatic enzymes, which may be elevated in conditions such as pancreatitis. Blood glucose levels and glycated hemoglobin can help assess pancreatic function related to insulin production. Liver function tests. Because the functions of the liver and pancreas are closely related, liver enzyme levels can provide additional information. Ultrasound. An abdominal ultrasound is a non-invasive way to view the pancreas and detect abnormalities such as gallstones, cysts or tumors. Computed tomography scans provide detailed cross-sectional images of the pancreas and surrounding structures, helping to identify inflammation, tumors, or other abnormalities. Magnetic resonance cholangiopancreatography provides high-resolution images of the pancreas and bile ducts. Glucose tolerance test. This test evaluates the pancreas's ability to produce insulin in response to glucose. Secretin stimulation test evaluates the pancreas' ability to secrete digestive enzymes. Biopsy. If imaging tests reveal a tumor or suspicious mass, a biopsy may be performed to obtain a tissue sample for pathological examination. Early detection and diagnosis are crucial for effective treatment of pancreatic disease.